And thank you so much for joining us for another edition of All Angles. I'm Dion Jackson Miller, and a very special welcome to those of you watching online at onespotmedia.com. So, in this segment of the program, we're going to be hearing from Dr. Chris Sharpe, consultant anesthetist at the Norfolk and Norwich Hospital in the UK. Later on in the program, we will be talking to a number of experts here in Jamaica, getting various views on what's happening with COVID and the Omicron variant. But first, let's go to Dr. Sharpe. Dr. Sharpe, thank you so much. We appreciate you talking to us.
Thank you for having me.
Well, tell us from where you're sitting, what does Omicron look like?
Well, the problem with the Omicron variant is that it spreads so rapidly, and considering that the first two cases were on the 27th of November, as of today, they think that they have about 10,000 cases of that 78,000 of new cases. And what they think is that the 10,000 cases are an underestimate of what is actually there. So, from my point of view, it appears that the government has gone into overdrive with trying to expand the vaccination booster program, but also trying to get the people who have not had any vaccines so far to become vaccinated. And you can also see the push in terms of things like the COVID pass that you mentioned, which will kind of encourage people to have the vaccine. So there is a sense of urgency from the government, but it's also being transmitted to the people.
Well, what about you guys as healthcare workers? We know the healthcare workers have borne the brunt of this pandemic. The various waves have really affected them significantly. How are healthcare workers feeling hearing all of this and hearing yet another variant of concern?
It is serious cause for concern amongst us healthcare workers. The hospitals are full of patients. The majority probably are not COVID patients, but there's been a lot of patients who've come into hospital because of health problems which haven't been dealt with during the pandemic. The staff have worked very hard, and during the first wave of the COVID pandemic, a lot of the staff were actually sent to the intensive care units to help out and on the COVID ward. So, there was a lot of upheaval, and what you found was that people are very tired. The other problem is that a lot of death, as you know, in the UK had one of the highest death rates in Europe. And because of the extent and vast number of deaths of all ages, it has had its toll on people. The other problem is that because of all of this, a number of healthcare workers have left the sector or they've moved to other parts of the sector. So a lot of intensive care staff have left intensive care to go and work in different sections of the health service. The other problem is that the staff who are also being affected by COVID. So whether they catch COVID, but the other phenomenon we've been seeing a lot of, especially in my department, is where children have caught COVID at school, or they have an upper respiratory tract infection and they have to be tested for COVID. So in that period, the parents have to self-isolate as well. So it has quite an impact on the health service.
What about the impact on you? How's it been for you?
For me personally, it hasn't been too bad because in the first wave, I was sort of protected from the COVID, so I didn't do intensive care. Some of my other colleagues did, but we did face patients who were potentially COVID positive, but in the end, their tests came back negative. Being not in intensive care, it sort of protects me to some extent. So I have been doing mostly what we call green patients, that is patients who have been tested negative for COVID and also been isolated. So I have not felt the brunt of it, but I know many colleagues who have felt the brunt of it. They're very tired, but they're bracing themselves for what's coming.
And what do you think is coming? I mean, based on what you're hearing from the authorities there.
Well, it appeared initially the Omicron variant was doubling every 2 to 3 days. It has been now declared by Dr. Jenny Harries that it's less than 2 days. So it is doubling very rapidly. It is claimed that the type of infection from the Omicron variant is not as severe. However, as you mentioned earlier, we've had our first death on Monday. With the sheer number of patients who will come down with this variant, a significant number will always play out by being admitted hospital, but also dying. So I think that we are in a very tricky place because the hospitals are full. We're trying to deal with backlogs of elective cases as well. And, something will have to give. So it's going to be very difficult going forward.
Because in fact, in terms of hospitalizations, the reports I've seen have said, your Prime Minister, I think, was quoted as saying that hospitalizations are up 10% nationally and up nearly 30% in London. And the concern is that, in fact, this will continue to climb. So when you say something will have to give, though, what's going to give to?
The stuff that will end up having to give will be the elective work. So in the UK, we have a massive backlog of elective work. So things like hip and knee replacements, things like that, those things which are not so urgent. Cancer is urgent, so they're trying to deal with cancer cases. But the other aspect of this is that with that boost in the vaccine program, the GPs who are at the forefront of it will not be able to see all of the patients that they would normally see. So what we find is that emergencies will continue as usual. Urgent things will continue. The vaccination program and the treatment of COVID patients will continue. But some of the routine stuff will have to give way to these priorities.
You're at about where now in terms of vaccination?
I can't remember the figures, but for example, in my hospital, I think almost all of the staff have had their full COVID vaccines plus boosters. In terms of nationally, I think yesterday they claimed that probably 25 million people have been fully vaccinated and had their boosters. So the numbers are going up. I might be wrong with the figures, but the numbers are going up. And you can see it on the news where after Prime Minister Johnson's statement on Sunday encouraging people to get boosted with their COVID vaccines, the vaccine centers have had massive turnouts, such that the booking process for NHS England broke down. It couldn't handle the weight of inquiries. So this will improve with time.
Okay, the figure I'm seeing is that about or more than 68% of the population is fully vaccinated. So is there then the hope that with the increase in the vaccination rate, that even though Omicron is spreading more quickly, more transmissible, that hopefully the vaccines in fact will help to mitigate the impact?
I think that is the aim. So essentially what you want to do is have people vaccinated as best as possible, so that if they do get breakthrough infections with COVID, because that is what is happening, especially with the Omicron variant, that the disease process will be much milder, and so that you won't get the massive hospitalizations and deaths. However, if you have the sheer massive numbers, it will still result in hospitalizations and deaths to some extent.
What's been the reaction to, I mean, what are you hearing from, say, your patients or just general members of the public, doctor? Because a lot of people now seem to be almost punch drunk. They're saying this thing is just not going away. Every time you turn around, we hear news of a new variant or some other problem we're having to be dealing with. So what are you picking up?
I think people are getting nervous about it. People are a bit resigned. A lot of people that come on the television say that they're not very happy with restrictions, etc., but they will go with it to protect themselves and to protect their families. So I think a lot of people want to have their vaccines and they want to do the right thing. So, I'm an anaesthetist, and all the patients who come in have to be tested for COVID 3 days before the operation. They have to self-isolate. And I've hardly come across any of the patients that I personally have done who have not been vaccinated. So I think uptake is quite, especially in the area in which I am.
Wow, that's pretty good. What about healthcare workers? Are healthcare workers universally or almost universally vaccinated at this point? Do we know?
I think the majority have been vaccinated. There are a few who are anti-vaxxers and refuse to take the vaccine. One of the bills that came through the House of Parliament yesterday was the passage of the law to say that people in the health service would have to have mandatory vaccination. That's going to be problematic in terms of quite a number of people who have not had the vaccine. But the majority of people, I think, have had the vaccine. I think probably over 90% of the staff.
Right. All right, I'm going to leave it there. Thank you so much, Doctor. We appreciate you talking to us on all angles.
Thank you very much for having me.
And stay tuned. We're back after the break.